My name is Mark. I work as a dentist for At Home Dental. I've always found domiciliary dentistry to be more rewarding. It's because of the kind of patients that you're looking after. As we all know, we're in a country where the population is ageing quite significantly. And it's not just due to the pandemic. There's so many people who are isolated and vulnerable and in their homes. And some of them have got good families and whatever and carers to support them, but there's so many that haven't. I'm really quite passionate about this interface between healthcare and social care, because that's what we're dealing with. It's not just dentistry here, it's a bigger subject than that. It is this interface between healthcare and social care, and I feel we can really make a difference. The gratitude from the patients can be expressed in different ways, but often it's just that elderly person maybe grabbing your hand and just expressing just how pleased they are and just how happy they are that you've actually come and made a difference to their lives. Whether it's get them out of pain or fit a new set of dentures, it's something that's actually means an awful lot to them. And you know, as a human being, you can feel that.
So I'm Julie Peterson. I work for At Home Dental as a dental therapist. So as a dental therapist, I can do new patient exams, any examinations. We do oral cancer screenings, we take x-rays, we take photographs, we do simple restorations, and we do cleaning and scaling and polishing of the mouth. I first came across At Home Dental from an advert, and I just remember thinking what a great idea it was, what a great concept. And I want to be part of it.
My name's Natalie, I'm a dentist working for At Home Dental. So I first heard about At Home Dental, I think, through social media, and I contacted them just to find out a bit more information, because it just sounded like such a different way of practicing dentistry. You know, just being out and about on the road and visiting patients at home, you know, patients that can't get out to a general dental practice. Really appealed to me, to actually be able to help people that I haven't been able to help so far in my career. Our van it's got everything in it that you would find in a dental practice. So if we're going in for a checkup, we'll bring in all our checkup equipment, which is usually 2 backpacks and a table and chairs that we set up usually in the patient's lounge or kitchen or wherever there's space. I've got like a little head torch that I wear on my head, which just then I can see the patient's teeth really clearly. We've got a computer and a laptop that we set up that we can do all the charting for the patient, and we've got a camera that we can use as well.
My name is Zara and I work as a dental nurse for At Home Dental. So an average day working for At Home Dental in the role of a dental nurse would be to firstly make sure that your patients are as comfortable as possible. The dentist or hygienist or therapist or technician, whoever it may be, are going to also be doing that, but it's a joint effort. You both need to be on the ball all the time to support your patient. You also need to be really keen and aware of cross-infection control, especially when we're in patients' homes. You're not in a normal surgery where everything is clinically already set up for you, so you need to be aware of your environment all the time. And I think most importantly actually would be working well with your dentist or whoever it is you're working with that day, communicating. It's that big word of communication, to make sure that you're always talking, you're always interacting, and you're making sure that you can provide the best service that you can to that individual on the day. So making sure that you're always talking about your day, what went well, what possibly didn't, were the notes all correct and present? Did we get all of the admin finished? Did we get the route done well today? And all of that communication means that we're providing the best service we can to the patient, which is crucial.
I'm Sarah, I'm Operations Manager working for At Home Dental. There is very little competition in this market, given the barriers to entry, a domiciliary care environment and the restriction placed on that service by the Care Quality Commission. We have opportunities for clinicians, dentists, nurses to join our team as we are rapidly expanding across those areas. And we really would welcome anyone that wants to apply or even just come and visit us for a day to see how we operate. We'd love to hear from you.
I mean, if you were a dentist considering joining At Home Dental, I would ask you, are you a curious person? Would you be interested in something different? Are you ready for still been doing your job in a completely different environment? Are you dynamic? Are you not afraid of challenges? Are you constantly adaptable? If so, join us.
I just feel so much more fulfilled working for this service. I can use all my skills and I have no limitations, no dentist breathing down my neck telling me I might have missed something. I'm my own boss.
So for any dentist that's considering working with At Home Dental, I would say definitely give it a go. It's been a great experience for me. It's expanded, my clinical knowledge, my experiences, and I've really enjoyed it. And it's a lot more interesting than working in surgery all day.
If you're a dentist who's, like I was in my 30s, very frustrated with working in a surgery and some of the time constraints and the extreme time management that can involve, then this is a very different kind of job where it's less about time, but it's more about the skills you can give to a more vulnerable and needy group of patients. The rewards are that you get a lot more gratitude. You feel like you've achieved more because you're making more of a difference to that person's life.
I would say the benefit for being a dental nurse working for At Home Dental would be that you don't get the grog that you sometimes feel of a surgery experience, where you're setting up for the next patient, and you never get a change of environment. You never ever have the same day twice. Even if you're seeing really similar kind of patients or carrying out similar treatment. So your day is always varied. So if you're looking for something that is going to get you out of what feels like an endless grog, then I think At Home Dental is the place that you would want to be.
The great thing about At Home Dental is that we are going into your home or your workplace or the place you live, and that changes the dynamic. It is a far more relaxed atmosphere. You are in charge when we come to your house, and that is nice. And actually, as dentists, we don't like working in a surgical environment where people are nervous and tense and there's a quick turnaround of patients and they're in and they're out. And actually coming to people's homes make them more relaxed, and funnily make us more relaxed. We can take our time, we can get to know you, and we can get to understand the problems and issues you have. So I think from our perspective, and all our clinicians enjoy that opportunity to get to know our clients and understand their needs. And as such, we do run a very empathetic service. At Home Dental are really excited about what we offer to our staff, to our nurses, to our receptionists, to our drivers, to our clinicians and dentists. It's very different to a traditional dental practice, and this is what attracts staff to us, because it gives them the opportunity to get out of the surgery, to do things which are a bit different to what they're used to. A lot of our dentists and therapists and hygienists, they often work for us for maybe 2 or 3 days, and then maybe work for 2 or 3 days in a traditional surgery. And that portfolio of jobs keeps people invigorated, keeps them very happy and satisfied. And we encourage people to not only work for At Home, but also to work in traditional dental surgeries as well.